Major developments from Flint, Michigan. Families there are being told that even filtering their water will not make it safe to drink. The lead levels way too high. And tonight, a bombshell email. After the water troubles there began, city officials were given bottled water. But what about all those families? Here's ABC's Alex Perez.
Embattled Michigan Governor Rick Snyder is facing harsh criticism tonight for the latest revelation in Flint's ongoing water crisis. Emails exposed by Progress Michigan reveal the state shipped bottled water to its workers in Flint some 8 months before residents were officially told the drinking water was unsafe. Governor Snyder's reply?
I had no knowledge of that taking place.
The emails included a department memo which said coolers will be provided as an option, quote, as long as the public water does not meet treatment requirements. The city had warned sick and elderly residents of potentially harmful chemicals in the water, but reassured them it was otherwise safe to drink. The state defends their decision, saying they only provided bottled water to employees temporarily until that particular chemical threat was over. Dangerous levels of lead were later found in Flint water, and about 200 kids so far have tested positive.
Knowing that somebody did this to my kid, it's hard. I can't sleep at night.
And tonight, officials are now warning that the filters they handed out to residents may not be effective enough to keep their water safe. Alex Perez, ABC News, Flint, Michigan.
I'm here, Mino, with Mr. Mangum here. How here in Flint, Michigan. Mr. Mangum, how's the Flint crisis affecting you and your community?
Well, the Flint water crisis has had a dramatic impact on my family. All of our drinking water has to be bottled. If the city let our children drink contaminated water for months and months and told the citizens that the water was safe, to make sure that my kids don't receive any more damage to their body by drinking the city water. Using bottled water is safer for the children and their parents. There aren't too many millionaires around here in Flint, Michigan. How are these people going to afford the medical bills that are going to be incurred as these children grow older? Are suffering right now because of decisions made by the city and the state. I mean, my kids like Kool-Aid, they like ramen noodles.
Yes.
And now we gotta have bottled water just to have lunch. The water has ruined the pipes all throughout the whole city, not just on the north side or the south side, but throughout the whole city. Did the city ever care about our children or us as citizens, or the citizens of Flint just too poor?
Yes, Mr. Mangum, very serious, concerned citizens here out here in Flint, Michigan. Very glad to talk to you. Thank you very much.
Daniel Thomas, thanks for coming on the show with us today.
Thank you for having me.
No problem. And today's topic would be about the Hobby Lobby versus Burwell case, which under law for-profit employees who offer coverage must offer insurance benefits for birth control and other reproductive health services without a copay. And today's question for you would be, what is your opinion on the Hobby Lobby versus Burwell case?
Well, in this particular case, I'm definitely agreeing with Burwell. Women should have contraceptive plans for health insurance because I believe that's their decision if they want to have a baby or not, and they should take preventive action on it. And I don't believe that religion should play into it.
Okay, great answer. Okay, and how do you think access, quality, cost tie into the Hobby Lobby versus Burwell case?
The Iron Triangle, it has its own role in the Hobby Lobby versus Burwell case. When it comes to cost, you are receiving birth control for free. And then without access to contraceptive coverage, quality ties into the case due to the fact that without a plan, you would have to wait in the hospital. If a woman would have to have an abortion. Excuse me.
And do you believe the Hobby Lobby deserves to win the case?
I do not agree that Hobby Lobby should win the case because, again, how are you to try to tell someone if they should have a baby or not, and how if they should prevent it or not, even if they're Christians, you know, because you shouldn't limit the people about how they feel about things.
I definitely understand. Thank you for all your opinions today.
Thank you for having me.
Cultural competency as a healthcare professional is very important to know. It is a set of congruent behaviors, attitudes, and policies that comes together and form a system that helps healthcare professionals work effectively in cross-cultural environments. As the picture states behind me, your power is your difference. Now we're going to go into a scenario where cultural competency is coming into play. Thank you.
Good afternoon. I'll be your doctor today. I'm Dr. Thomas. What's your name?
Melissa Darius.
Would you spell that for me?
Yeah, Arabic.
Can I get a translator in here, please? Hi, she doesn't speak great English, so would you just translate her for me?
Assalamualaikum.
What's your name?
Ismi.
Melissa Darius.
Gergis.
Okay. And what brings her in today?
Gabriel Naharto. It's more of a female issue. معلش أنا أتكلم or تبي حد تاني? Okay. Yeah, she would actually rather me not translate. She doesn't really want me in the room. She doesn't feel comfortable. It's not really.
Okay. Well, would you mind asking her how long she's been that way, and then I can
get
it started?
Minute. About like a month to give or take. Yeah. If you need more, we can just get a phone translator.
Okay. Thank you so much.
Yeah, no problem.
My husband just a couple of days ago that I didn't think I was going to make it through the storm, and he said, "What do you mean you're not going to make it through?" Because I'm going through too many ups and downs, the roller coaster emotional thing. Because I'm crying, I'm thinking more about death now than I ever did before. Because I almost died, almost drowned, and not because I put myself in that position, but because nobody came to save us.
A lot of people from New Orleans have gone through a lot of emotional and mental damage due to the hurricane. A lot of people in New Orleans sat there and watched their loved ones get pulled down into the water, drowned alive, get squashed or collapsed completely by cars slamming into them that were floating in the streets, or get trapped under houses because their body floated under there. And a lot of people got trapped and saw a lot of people die. A lot of people have come down with situations, what they call post-traumatic syndrome. And what happens in that is when something very traumatic happens to you, it breaks something in the mental brain waves where it just short circuits you. And it takes you from 0 to pissed off in about 3.2 seconds. And where somebody accidentally bumping you, you might, oh, my bad, on the norm. But people that have gone through what they have in New Orleans, somebody bumps them now, it's like, boom, they want to shoot people. And that's the type of anger that people have for losing their houses, losing their loved ones, knowing that the City Council of New Orleans could have prevented this 25 years ago.
Hello, I am here with Sergeant Forever Ready Williams, and I would like to know, how do you deal with the nightmares or the flashbacks?
Well, those are real hard. They give us medication to try and cope with the nightmares that happen. The worst nightmare that I've experienced so far was I was laying in my bed and I had a flashback. And at the time, my girlfriend was next to me and she heard me screaming. And she grabbed me to try and wake me up. And I grabbed her and headbutted her and then almost punched her in the mouth. But at that time, I gained consciousness. And when I realized what I was doing, that was one of the hardest nights of my life.
Wow. So, what are some of the hardest things you had to get through while being overseas? What are some of those flashbacks?
Some of the flashbacks of the hardest incidents that occurred while I was overseas would probably be what triggered everything for me. My platoon was on patrol in Afghanistan, and while on patrol, they deviated off the road and ran over an IED. And at that point, the Humvee was thrown 50 feet in the air. I was thrown from the Humvee as soon as the IED exploded, and I was actually the lucky one. The rest of the members of my platoon suffered traumatic brain injuries, loss of limbs. I'm blessed to still be alive.
Thank you, Sergeant Forever Ready.